ADDY works on a small number of women. Did that ever make you think twice about bringing it to market?
No drug works for all patients. And I think that we've gotten particularly hung up around this drug because the effects are subtle shifts, not unlike antidepressants, right? The way in which they work are these subtle shifts back to normal, not an instant fix like a Viagra. That's some of the reason why I get frustrated with that comparison, because I think it sets up an expectation that doesn't understand how it should work and what success would be defined as.
Tell me how the performance is doing, so to speak,
Yeah, sure.
of sales. Because a couple weeks after it was out on market, reports were surfacing that the sales were not what you had expected them to be, but you say that's not true.
So the number that has been out there is inaccurate, but no company goes out and in the first 2 weeks says this is exactly how many prescriptions we have. I'll wait for the company to make a decision on disclosure. What we have talked
how did
about.
That number get out there?
So I think the number came from an audit of data that isn't reflective of all of the prescription data. It surprises people that we really have taken a different approach, right? We said to the FDA we were committed to not going out with a marketing campaign. I think people can't believe that about a pharma company, but this has been always about getting it right for women. So our goal out of the gate is education. We in fact agreed with the FDA that we would certify healthcare providers or pharmacies to be able to prescribe or dispense ADDY. That takes some time, and at this point, just 6 weeks in, a little bit less than 10,000 healthcare providers are already certified, and a little under 30,000 pharmacies are certified to dispense or prescribe ADDY.
The FDA approval process was quite a long road. Did that change your thoughts on the approval process in general?
I think the biggest distinction was really just the conversation we had around female sexuality versus male sexuality. Who knows better than the women themselves who are living with this, what it's like, and really I think hearing them really opened all of our minds to the science. Science ultimately won.
So many people did frame this as a gender justice issue, saying that there was unconscious bias going on. So do you agree with that?
I think there was a societal narrative that we are all subject to, which is that all things for men in the bedroom are biology and all things for women is psychology, right? The truth is both genders bring both things into the bedroom, and if anything is misfiring in either area, I think it deserves addressing.